Thank you.
My question is, and I'm throwing this out to you, what exactly is the crisis in healthcare? I've been hearing about crisis in healthcare ever since the Hillary days. And quite honestly, I don't see it. Now, I'm not among the intellectual elite in this country, but
Good.
I still can't see it.
Good means you're a real guy.
Thank you.
You bet. It's a great question. The crisis in healthcare is like the crisis in everything else, manufactured.
Precisely.
Take a little survey. Dale, are you personally fretting? Are you in crisis mode? Are you walking around in a general state of fear over the fact you might get sick?
No.
Do you know anybody who is?
Oh, there's a lot of hypochondriacs out there, but
yeah, but I mean, they worried about losing everything they own if they do get sick.
Well, sure, but there's a real easy solution to that. And I'm a small businessman out here, and by small I mean probably micro business. I employ anywhere from 6 to 10 people, depending on the economy. I am able to offer my employees, at no cost to them, major medical coverage through Blue Cross and Blue Shield of Kansas for $150 a month each. And I pay for that, by the way.
Yes.
So what's the crisis?
That's my point. That's my point. There is no. You're asking a very valid question. There is no crisis. The crisis in healthcare is in the UK. The crisis in healthcare is in Canada. The crisis in healthcare is in Cuba. The crisis in healthcare is with the JICOMs. The crisis in healthcare is with a lot of other places. The crisis in healthcare here has been manufactured. My point is, folks, just ask your Heritage Foundation today. Simple to get. Great stuff here. Yesterday, the nonpartisan CBO released a preliminary analysis of the Kennedy-Dodd healthcare plan. The results are frightening. Assessing just Title I of the draft legislation, the CBO estimated the plan. Now listen to this. Look at me. CBO estimated the plan would add $1 trillion to the federal deficit while only extending healthcare insurance to a net 16 million more people. Now, I mentioned this earlier. $1 trillion for one-third of the uninsured. As scary as that is, what is even more disturbing is what costs the CBO did not estimate. Quote, our proposal does not include a public plan that would be offered in the exchanges, nor does it contain provisions that would require employers to offer health insurance benefits or impose a fee or tax on them if they did not offer insurance coverage to their workers. In other words, the $1 trillion cost to insure 16 million uninsured does not include the public option. And the public option is the deal that Obama wants. And this cost doesn't even estimate. What Obama's going to do is throw this out. They'll say, this is not accurate. We're going to listen to this. And he'll have his own Office of Management and Budget do it. Now, even without the public plan, even without Obama's public option, the CBO analysis undercuts one of the fundamental promises Obama has made about health care reform. In fact, yesterday, talking to the AMA, he said, if you like your doctor, you'll be able to keep your doctor, period. If you like your plan, you'll be able to keep your health care plan, period. No one will take it away no matter what, unquote. The CBO, so-called nonpartisan CBO, disagrees, according to their analysis. While the Kennedy-Dodd bill would enable 39 million Americans to obtain health insurance, the plan would kick about 15 million people out of the system because their employers would no longer offer insurance. The employers would opt into the public option. There are a lot of employers want to offload this. Coverage from other sources would decline by 8 million, so 27 million people would be thrown off insurance rolls and have to go public option. You would lose your choice of doctor. These numbers will only look worse once a public plan's factored in, and the public plan is just one of the biggest problems of the Kennedy-Dodd bill. An independent analysis by the Lewin Group shows that a public plan will deprive millions of Americans of their current health care plan. Depending on eligibility and payments, the rates this could result in up to 119 million Americans being switched by their employers from their existing coverage or transferred to government-sponsored coverage. This is why it's Trojan horse, and this is why he's able to deny this is not going to happen. But in the real world, where they never score dynamics, they only score statics in these things. They score the dynamics. You got a bunch of businesses with a chance to offload their health care expenses to the so-called public option. You don't think that some will do it? And the estimates of the numbers that want to do it will lead up to 119 million Americans being switched by their employer to some other coverage or transferred to government-sponsored coverage, the public option. We'll be back. Stay with us.